afternoon, good morning, welcome wherever you are in the world. My name's Juliette Foster and thank you so much for joining today's session, a high-level panel discussion on uninterrupted health services for NCDs during the COVID-19 crisis. It is organised by the Defeat NCD Partnership at the United Nations Institute for Training and Research, otherwise known as UNITAR. Now, as we know, the world is facing multiple humanitarian crises at the same time as the ongoing COVID-19 pandemic, which has caused the loss of over 3 million lives. However, an even larger number, nearly 41 million people, die prematurely each year because of non-communicable diseases, or NCDs. National governments, supported by such bodies as the World Health Organization, the United Nations, and multilateral development banks, are at the forefront of tackling this challenge. Overcoming it will be key to achieving UN Sustainable Development Goal 3.4. For those of you who don't know what that goal is, it is the reduction of premature mortality rates caused by NCDs by 1/3. The deadline set to achieve that is 2030, so not long ago. Now, this high-level panel discussion will respond to our call to action by reflecting on the possibilities that break the link between NCD and COVID-19 mortality rates and promoting creative ways to leverage COVID-19 response efforts and support strengthened health systems. Now, at the same time that we're gathered, there is the World Health Assembly, which is taking place. So just a heads up that some of the attendees at our event will be moving sessions. So some will be able to stay with us through the entirety of our panel, but some of them may leave us. But to those who are involved, we thank you. We are grateful for your presence here amongst us. So we have a lot to get through, and let's start things rolling by introducing the importance of this call to action, why it matters. And I'm joined by the United Nations Assistant Secretary General and Executive Director for the UN Institute for Training and Research, Nikhil Seth. The floor is yours, Nikhil.
Thank you, Juliet. Excellencies, colleagues and friends, an important component of UNITAR program is the Defeat NCD Partnership. And I would like to congratulate the Defeat NCD Partnership for organizing this event today. As we meet today, the front page of newspapers remind us that we have lost 3.5 million people due to COVID-19. And WHO feels that this is underestimate. It's a tragic number, and we should learn to do much better. What we are not learning behind all these grim statistics is how many of these 3.5 million people and beyond we have lost to COVID are NCD patients, non-communicable disease patients. It is established that patients with diabetes, cancer, cardiovascular diseases, and other NCDs are the most affected and the most at risk for severe COVID-19 disease. That is why it is an honor to be here today in the presence of Dr. Harsh Vardhan, the Minister for Health and Family Welfare of the Government of India and Chair of the World Health Organization's Executive Board, Dr. Dechen Wangmo, Minister of Health, the Royal Government of Bhutan, and President of the 74th World Health Assembly, and congratulations on your elections, Madam. Dr. Daniel Ngamije, Minister of Health, Government of Rwanda, Dr. Amadou Lamine Samate, Minister of Health, the Government of the Gambia, which indicates the global priority national governments are giving to jointly tackle the twin challenges of COVID-19 and the non-communicable diseases. This is indeed a timely call to action by the Defeat NCD Partnership and partners as the world continues to grapple with the twin challenges of the raging COVID-19 pandemic and the underlying health crisis of non-communicable diseases, a growing problem which leads to over 41 million deaths annually, premature deaths. One way of overcoming some of the constraints and challenges posed is through leveraging artificial intelligence and telemedicine. We at UNITAR are committed to supporting national capacities to achieve the SDGs, particularly SDG 3, enabling universal access to healthcare. The Defeat NCD Partnership hosted by UNITAR is targeted at reducing mortalities due to NCDs by 1/3 by 2030. However, the COVID-19 pandemic has disrupted health services and over 75% of low and middle income countries, making this goal much more difficult to achieve. The Defeat NCD Partnership at UNITAR has initiated capacity building initiatives in Myanmar, Rwanda, Gambia, and we are scaling up support in India, Ecuador, Bhutan, Nepal, and the Caribbean region to develop multi-sectoral action plans to reduce the impact of NCDs on society. We have also launched the Defeat NCD Marketplace to provide quality-assured, fairly priced NCD drugs and diagnostics to lower and middle income countries to overcome the gaps between demand and supply. The presence today of Dr. Bandar Hajar, President, Islamic Development Bank Group, representatives of the Asian Development Bank, is heartening, as this indicates global commitment to finance the health infrastructure to meet the growing burden of NCDs and COVID-19. In addition to the participation of the Qatar Ministry of Health, represented by Dr. Mohammed Al-Thani, showing Qatar's commitment to support our efforts to make the availability of quality, affordable medicines and supplies a reality for the most vulnerable. It was also great to see my friend, Dr. Navarro, one of the most persuasive and strong champion on health issues that I have met. The health sector has been historically underfunded, and within the health sector, NCDs have had extremely low in priorities. No wonder then that today 71% of global mortality is due to NCDs. The Defeat NCD Partnership is partnering with leading private sector healthcare companies such as Viatris, which I am pleased to welcome today, multilateral banks, the International Finance Cooperation, Multinational Investment Guarantee Agency, and bilaterally with governments to develop innovative products such as social impact bonds to provide universal access to healthcare in LMICs. I hope that this high-powered call to action from some of the world's leading health ministries and multilateral banks will stimulate action in the global community and in national governments to step up screening for non-communicable diseases and continued uninterrupted healthcare to patients in need. Thank you, Juliet.
Thank you, Nikhil, for that introduction and also for outlining the challenge that lies ahead and the collective work which is happening at every level to make sure that we live in a safer world where health services are equitable for all. Now, I want to move on so that we can have an insight in some of the key research that has led to today's event. And it's at this point that I would like to invite to the floor Praveen Pardeshi. Now, he is the Programme Coordinator for Global Scale-Up at the Defeat NCD Partnership. So, Praveen, the floor is all yours.
Thank you, Juliet. And as our Assistant Secretary General mentioned, the elephant in the room is really the non-communicable diseases. What we started observing, as you can see from this graph, that when the society is very healthy, even if the COVID infection is high, the COVID case fatalities are very low. A case in point is Singapore, which has amongst the lowest non-communicable disease mortalities, which is 186, which is lower than the global average by more than 50%, and its COVID case fatality rate is less than 1%. But as we move up the line of having more, having higher mortalities due to non-communicable diseases, the curve of COVID case fatality rate keeps going up. So we use this initial observation to do some serious number crunching. We joined the Economist Intelligence Unit and Beatrice, and what we found is an astonishing result. When we did number crunching across 150 countries, we found that every 10% reduction in the annual non-communicable disease mortality rate, that is, if the society becomes healthier by having less mortality due to non-communicable diseases, the COVID case fatality rate declines by 20%. Now, this was a very interesting observation. If we look at the current COVID case, the non-communicable disease burden, which is on an average 5 per 1,000, it leads to an average of 2.4% COVID case fatality rate. A country of 60 million will, with the 10% rate of infection, could have almost 144,000 deaths. So this is not a very healthy society. If we go further, and if we were to achieve the SDG of reducing by 1/3 the COVID, the non-communicable disease mortalities. So we reduce it by 1/3 from 5 to 3.75 per thousand. We find that the decrease in mortalities due to COVID comes down from 144,000 to 108,000. And if we were to halve this rate, which is possible because countries like Singapore have already shown this, we find that the COVID case fatality rates will go down to 1.4 per 100, or just about 84,000. So simply looking at this data, it has huge implications for our programming, that to control COVID, we need to actually reduce the underlying disease burden due to non-communicable diseases. Now this has an implication for our global programming. The World Economic Forum calculated that we need $371 billion per year to reach the universal access to health. But if this would take up to 2030 to reach, if we spend $371 billion. But the world has committed already $10 trillion for achieving the, for responding to COVID, which means that we had already spent 2.8 times more than what was needed. So this meant that if some of the resources of COVID could be re-engineered and could be applied in a synchronized manner, for example, the COVID vaccination, track and trace services could be used to also detect for non-communicable diseases, then we could take on the challenge, the twin challenge of COVID and NCDs in a synergized manner. And that is exactly what the Defeat NCD is seeking to do in its program countries, where we said that the two battles are to be joined together, and basically COVID is just an X-ray revealing the underlying non-communicable disease burden. Thank you.
Thank you very much for that presentation, Praveen Pardeshi, which really was excellent and very powerful. And can I alert our audience to the fact that we're going to look at that research a little bit later on in the session with the other partners who are involved in this, the Actress and the Economist Intelligence Unit. But Praveen said that there are implications arising from that research, and we're going to look at those in a little bit more detail with our speaker, Dr. David Nabarro. So, Dr. Nabarro, thank you so much for joining us. Now, let me tell you a little bit about him. He is the co-director of the Institute of Global Health Innovation at Imperial College London, and also strategic director of 4SD, and of course special envoy of the WHO Director General on COVID-19. So we appreciate the fact that you have taken the time to be with us. Now, Dr. Nabarro, you have been at the forefront of global efforts to control the pandemic. And in this time, we have seen the world coming together to contain the pandemic and at the same time develop various treatments, notably the vaccine rollout program. But you and I are both aware that there are disparities, the fact that 85% of vaccinated people are in 12 countries. So that is pretty one-sided. So what are the main lessons and indeed guidance that should be applied to the NCD context, given that we're over a year into this pandemic? So what is it that we can learn from and indeed build on?
Thanks very much indeed. Juliet, it's a meeting that I would not have missed for anything. It's so important. And it's a chance to really acknowledge the presence here of some really important and influential people. I would just like to greet all ministers, colleagues and friends, but particularly I'd like to give a special reach out to the chair of the WHO Executive Board and the chair of the Assembly, who are both here. Really fabulous to see you. And what am I personally seeing with COVID? I'll just tell you three things. One, it's not ended. It's still ferocious, and it's got a long way to run. And we need to continue to get ourselves focused on the rest of the marathon. And I believe the worst part is yet to come. Second, the world could do much better on COVID. Somehow, as a world, we've not found it so easy to pull together like we did at the beginning of HIV and like we've done on so many other global issues. I think it's partly because COVID is quite deceitful. Many leaders have ended up thinking that somehow it's just a mild disease, a bit like flu, and that if we're strong, we can fight it off. And if as a nation we're strong, we can win. But I think what we've learned, Juliet, during the past year, is that this apparently mild illness is actually very serious indeed. Long COVID affects about 1 in 20 of those who get the virus. And we haven't started to compute what the impact of this long-term reduction in people's capabilities is going to be. COVID, as you've all pointed out already, is the great revealer, and it's revealing fault lines in society that we've kind of come to terms with, but now we realise they're just not incompatible with a sustainable future, particularly the extraordinary levels of inequity in our world, and secondly, our failure to work together on governance of dealing with a global health issue. So we could do better. And in a way, we've been deceived by the apparent mildness of the disease. This is not a mild disease. This is a ferocious, unpleasant, and destructive virus. And it needs the global response that WHO is fighting for, and it needs it immediately. Thirdly, COVID is about inequity. Poorer people everywhere get it the worst. Poorer people everywhere find it hardest to access care. Poorer people everywhere are affected by the containment measures more than anybody else. It's a disease that is actually highlighting the inequities in all societies. Just look at the epidemiology from the United Kingdom. The hotspots right now are in the poorer parts of the country. And that's something that everybody needs to understand. So where do we move from here? Number one, a lot of the extreme illness and death is in people who are suffering at the same time with what are called non-communicable diseases, but what I would like to refer to in particular as chronic disorders of the metabolic system and of the cardiovascular system. In particular, diabetes just carries a much worse prognosis. And so the non-communicable diseases are revealed by COVID, as Parveen just said. And we've got to respond to COVID in a way that takes non-communicable diseases seriously. Number two, people are the solution, because the problem is caused by a virus. So everything we do in government, in civil society, in our professional organisations, in our businesses, must be to empower people so that they can work out for themselves what life living with COVID is going to be like in the foreseeable future. This is not going to be a COVID-0 world for a very long time. So instead, we have to live with the virus in a way that enables us all to hold it at bay. And number three, we won't, as a world, be able to vaccinate ourselves out of this pandemic in a hurry. Everybody who is at risk should be able to be vaccinated. That is key. But the use of vaccines as the primary means to stop the pandemic will mean that certain countries will hyper-vaccinate their populations because they see this as the best containment strategy. But that's not the way to use vaccines. Vaccines prevent death amongst the high-risk population, particularly those with NCDs. We should be prioritising vaccines for those who are at risk of death. And the process of dealing with the pandemic should be built around basic infection disease procedures, a fully engaged population, a highly effective public health service that can detect people with the disease and isolate them before it's confirmed, and then the necessary contact tracing and quarantining process that stops clusters from developing into spikes, from developing into surges, and surges becoming explosive outbreaks. There's only one way to deal with this pandemic, and that's through the full involvement of the people and the widespread pursuit of public health measures. Reliance on vaccination to end the pandemic at this time is most unwise. In conclusion, people with non-communicable diseases are being singled out by COVID, and they are likely to get severely ill and to die. As a world, we can prevent this suffering and death through the proper use of the precious vaccines that have been developed as part of immunologically shielding those most at risk. As a world, we can deal with an issue like COVID through empowered people and widespread, well-developed, properly supported public health services, networked together by a well-equipped World Health Organization. But those public health services need to be led by governments that prioritize public health and that do not continue to see reductions in public health capacity and capacity to deal with major challenges like non-communicable diseases and with the movement of monies into acute health services. Acute health services cannot provide public health care. In summary, get the public health right, focus on equity, protect those with non-communicable diseases, use vaccines fairly, and then we might be able to come through COVID without long-term major damage to the social, economic, and political fabric of our world. Thank you.
Dr. Nabarro, thank you so much for that very powerful message, and also as well, thank you for dispelling some of the myths surrounding COVID-19, because they are there and it has impacted the way that some people respond to this, indeed the way that some individuals treat it. But thank you so much for that powerful presentation and the very coherent message underscoring it, and I know that it has resonated with Dr. Harsh Vardhan. Now, he led a very successful career as a medical doctor and is currently the Health Minister of India, so thank you so much for being with us. He's also the current chair of the Executive Board of the World Health Organization. And Dr. Vardhan, we know that India is in the headlines. I don't really want to look at that. What I want to do is to broaden things out, because the country, along with many others, it's had incredible challenges, and we've also seen positives which are very rarely referenced in the narrative, including having the largest vaccination program in the world and making huge strides in COVID-19 testing. The point that I'm getting at is that the Indian government has not lost sight of that connection between non-communicable diseases and COVID-19. So how would you characterize the challenges that India has faced, and what are the lessons that the rest of the world can learn from this?
Excellencies, colleagues in public health, ladies and gentlemen, let me begin by thanking the organizers. Defeat NCD Partnership at United Nations Institute for Training and Research for having organized a call for action session for countries to ensure the continuity of health services to non-communicable disease patients during the current humanitarian crisis. The Defeat NCD Partnership was born from the recognition that NCDs are now the major contributor to the global burden of disease, killing at least 41 million people each year. the equivalent to 70% of all global deaths. And added to this, the world is now facing an existential crisis, the global threat of COVID-19 pandemic, which has led to over 3.46 million deaths across the world. And friends, my country in India too is facing the brunt of the second wave of the pandemic. The COVID-19 pandemic has had a major impact on the capacity of global health systems to continue the uninterrupted delivery of essential health services. While health systems around the world are being challenged by increasing demand for care of COVID-19 patients, the COVID-19 outbreak has placed unprecedented demands on our health system. Our health facilities and workforce are currently inundated by a plethora of activities related to controlling the pandemic. In doing so, essential health services which communities expect from the health system do get compromised. However, focusing on COVID-19 related activities and continuing to provide essential services is important, not only to maintain people's trust in the health system to deliver essential health services, but also to minimize an increase in morbidity and mortality from other health conditions. Also, to achieve universal health coverage and reduce premature NCD deaths by a third, healthcare systems need to radically transform. The Sustainable Development Goal mantra, to leave no one behind, underscores a broad public health approach and a call for action by all stakeholders. It is for this reason that world leaders, governments and stakeholders across all sectors of society are keenly viewing this high-level meeting on continuing NCD care during challenging times such as the present. In this very context, the meeting today represents a unique opportunity for all of us to come together and scale up action to prevent suffering and avoidable deaths from NCDs during the pandemic. Let me tell you a bit about what's happening on the India front. There is a silver lining as far as data on NCD is concerned. While 70% of global deaths are attributable to NCDs, in India this figure is estimated to be lower, around 63%. We have been able to reduce premature NCD-related mortalities from 503 to 490 per 100,000 population from 2015 to 2019. I am happy to note that various investments by my government have led to these reduced figures. Primary care for NCDs is now being provided in 76,102 newly established health and wellness centers across the country. Ayushman Bharat and Pradhan Mantri Jan Arogya Yojana have expanded the scope of primary health care to include screening and diagnosis of NCDs and eliminated out-of-pocket expenses related to NCDs for 100 million vulnerable people. India has been one of the first countries to launch a multi-sectoral action plan to reduce underlying NCD risk factors related to tobacco, salt and sugar, and uniquely targeted reduction of household pollution by replacing solid cooking fuel. This reduced chronic respiratory ailments among women, for example, through the provision of cooking gas to millions of rural households. My government's response to NCDs has been robust and aligned with political declaration conveyed in the high-level meeting on the prevention and control of non-communicable diseases at the United Nations General Assembly in 2011 and 2014. Friends, there is no denying that health systems around the world are being challenged by increasing demand for care of people with COVID-19, compounded by fear, stigma, misinformation, and limitations on movement that disrupt the delivery of health care. In such circumstances, we need to adjust governance and coordination mechanisms to support timely action and prioritize essential health services to adapt to changing contexts and needs. Friends, I strongly believe that as public health leaders, we need to make a renewed commitment to fund public health and remove financial barriers to access, as well as reprioritize and reprogram existing budgetary resources. And I am sure that the Defeat NCD Partnership is bringing together governments, the private sector, and the civil society to drive action in all countries. The world has enough knowledge, capacity, and even resources available to reverse the tide of NCDs. But collaboration will be crucial. This will work only if we are determined to come together to tackle the many obstacles to preventing and treating NCDs effectively. It requires shared idealism and shared collaborations. COVID-19 has created the need to apply innovative telemedicine technologies. India, with its huge IT private sector, has a distinct advantage. Artificial intelligence paired with telemedicine is powerful. India is targeting to reduce premature deaths by 25% by 2025, for which COVID-19 responses are being integrated with NCD screening and care, and IT and artificial intelligence potential are being maximized. Government allocations for COVID and other investments are being smartly dovetailed with our national NCD action plan. NCD diagnostics are being established alongside COVID screening, and NCD care services are being augmented into health and wellness centers. Friends, effective NCDs prevention and control require strong political leadership, coordinated multi-stakeholder engagement, and multi-sectoral action for health, both at the government as well as the private level. Much work lies ahead, but I am optimistic that with the energetic support of all our stakeholders and in the spirit of true partnership, we will make strong headway together in the fight against non-communicable diseases. Thank you, friends, for giving me the opportunity to participate in this most relevant discussion. I wish you all the best in your respective countries to be able to meet the current challenges thrown up by the pandemic. India stands together with the world. Thank you, and Jai Hind.
Much for your presentation and your words there, some optimism as well, and really stressing the connection with NCDs and COVID and the difference that the NCD strategy is making to the health of the people of the country, but also as well a reference there to the importance of bodies working together, funding. And this is where my next speaker comes in. This is Takeo Kanishi. Now, he's country director for India at the Asian Development Bank. It is so good to see you. Now, we know that the bank is ready to support the expansion of the COVID-19 vaccines availability. So, from the bank's perspective, how does it propose to do this? And can it also be linked to perhaps other vaccines? And I'm thinking specifically of the HPV vaccine for cervical cancer.
Thank you very much, Julia, and it's a great pleasure and it's an honor to be here tonight. And kindly thanking everyone around in allowing me to participate in this important discussion subject that has touched lives of all of us, and we're living in a very extremely difficult times. But the majority of the blood always in such calamity is being borne by the poor and vulnerable population in resource-constrained countries. And this is one of the reasons why that triggered ADB to plan and play an impactful role in Asia-Pacific and cognizant with our core belief of alleviating poverty. And this is currently the Asian Pacific region remains home for largest share of the world's poor, and are nearly 4 billion people served by ADB to a large share of the extent. Only lives in 263 million are living on less than $1.9 a day, and 1.1 billion on less than 3.20 a day. So COVID-19 is unfortunately pushed an enormous number of our people deeply into a long-lasting poverty. So the pandemic is an unprecedented event, and it changed the political, economic, and social and cultural fabric of our lives. And it has been relentlessly caused death and destruction, sparing no country and no category of citizen. And it's casting its spell equally to have and have-nots. Now, undoubtedly, all countries are doing their best to defeat this virus, and thus minimizing loss of human lives and livelihoods. In Asia Pacific, ADB has been supporting the country in all possible way, and in accordance with ADB Strategy 2030, that calls upon responding effectively to the region's changing needs to fulfill our vision to achieve prosperous, inclusive, resilience, and sustainable Asia and Pacific. Now, within the 2 months of the onset of the pandemic, ADB last year announced a $6.5 billion initial package to address the immediate needs of our member countries. Soon after, ADB approved an enhanced $20 billion package to help the countries to address the impact of COVID-19. ADB, we had a response to the pandemic focusing on meeting immediate challenges to help the country to procure emergency PPE, other necessary medical equipment, to slow the spread of the pandemic and mobilize technical expertise and strengthen risk communication and knowledge support to develop a national plan and strategy for effective response to the pandemic. Now, the rapid response by ADB gave country additional fiscal space to formulate a solution for addressing the social and economic impact of the pandemic and design long-term measures needed to sustain, to focus on sustainable and green economic recovery. The country rightly initiated efforts to efficient medical services to save lives and strengthening their COVID-19 management infrastructure. In addition to stopping the virus, various non-pharmaceutical interventions such as mobility and travel restriction, school closure, physical distance, expanding testing to detect cases, contact tracing, and quarantine and isolation were implemented. And awaiting available vaccine, these were considered effective measure, but with, shall we say, collateral damage to human economy activities, thus further constrains the economic growth. Now, ADB recognizes that in addition to access to vaccine, appropriate policy, financing, and knowledge support will be needed to meet the vaccine planning, procurement, delivery, and communication needs. And agile, flexible, and timely financing and knowledge support from ADB is playing an essential role in helping countries to meet these technical, logistical, administrative, capacity building challenges for vaccine in a race towards achieving desired immunity. To this end, ADB emerged through the challenges to establish a Asia Pacific Vaccine Access Facility, or APVAX, as you correctly alluded to. This facility provides a comprehensive framework and resource envelope of about $9 billion US dollar to support fast, high quality, and safe and equitable vaccine access in our member countries, to our member countries. Now, APVAX is designed to be flexible and provide advanced resources, finance urgent vaccine procurement, and complementary financing for vaccine delivery and distribution and administration. So we also have streamlined our internal process to cater to this needs with an urgent requirement. But recognizing the existing immunization system in the country focus on delivering a child vaccine, they have limited expertise, infrastructure for unavailing adult vaccination. Adaptation are needed to deliver vaccine to adult population by improving cold chain system, skills of human resources, biohazard waste, and accordingly, our efforts are being towards a comprehensive strengthening of the entire system that is essential to deliver quality vaccine until the last mile. The establishment of the APVAX facility to support our member countries to vaccinate procurement system for deployment, but we deepen our guidance from our agency, especially WHO and WHO-led programs program for making availability only internationally accepted, safe, and efficacy vaccines. And apart from the vaccine procurement and deployment, ADB is extending technical assistance for developing comprehensive national COVID-19 vaccine plan, including priority population identification, large-scale communication efforts for demand generation, risk communication and surveillance, and community engagement. Now, your question in terms of right now, the APVAX is solely focused on the immediate urgent need, and ADB strongly has its commitment to fighting global fight and containing the pandemic at this particular time. But however, a significant portion of, since the pandemic has arose last year, our portfolio, by requested by certain countries, have now started to shift it into more of the health system improvement.
Can I jump in one moment, Mr. Konishi, because you've given us a very comprehensive outline of what the bank is doing, and for that we're very, very grateful. I'm also conscious of the fact that there are other speakers and time is sadly running very, very tight. Now, I do appreciate as well that the Health Minister of India, he has stayed with us. So, Minister, if you could very briefly, and can I stress briefly, respond to what you've just heard from the ADB so that we can then hear from our other key speakers as well. Very briefly, Minister. I think we have a few problems connecting up. Are we connecting with the Minister, the Health Minister for India, Dr. Harsh Vardhan? If you could give us a very brief response to what you've just heard from the Asian Development Bank and its strategy in dealing with COVID and NCDs.
No, our strategy is very clear. You see, even at the grassroots level, as I had mentioned in my statement, that we are in the process of, through the Ayushman Bharat, we are in the process of creating 1.5 lakh health and wellness centers all over the country, and where the focus is on prevention, promotive health and positive health. And there, in fact, millions of people have already been screened for the hypertension, diabetes and the various cancers, and more particularly the breast cancer, the cervical cancer and the oral cancers. And we have found that this exercise has been very, very useful, and we are able to detect these non-communicable diseases at a very, very early stage. We have a network of at least 1 million ASHA workers spread all across the country, even at the grassroots level, even at the block level, and they have been trained adequately. There is a very robust monitoring mechanism for all these activities. So whatever we are in fact putting in the policy, we are trying to practice this at the ground level, and with a very robust monitoring mechanism, a feedback mechanism, and a revision mechanism of the strategy from time to time. We have seen by now rich dividends for our policy, and we are very strongly committed to ensuring, even during the COVID time, in every presentation that we made to the health ministers or the health officials of the country for COVID, because you know it was a new virus, so we had issued our first guidelines to all the states on the 17th of January 2020. But after that also, in every meeting, every presentation of COVID was also simultaneously supplemented and followed by a presentation on how do we keep in touch with the care for the non-COVID patients, and in that, of course, all the NCDs were covered, tuberculosis was covered, the care of the pregnant women was covered, care of the children was covered, the vaccinations, immunizations. So we have been practicing all this through COVID times also, and I think COVID has also taught us a lot of lessons, which of course will certainly in the long run help us in strengthening our healthcare facilities and systems. We have already devised a very robust plan for in fact strengthening and scaling up our infrastructure, not only the treatment part but also the diagnostic part at the block level, with various types of laboratories, including the biosafety labs at multiple levels, the diagnostic labs at the block levels, and the emergency hospital facilities at the block level. So this is all being strengthened, learning from the COVID experience. So I fully endorse what has been said by our the dear person from ADB, and we can assure all relevant stakeholders and all those who are participating in this debate, and of course the Defeat NCD Partnership, that India is thoroughly committed to realize what is your vision, and we will certainly implement whatever best is possible, and we will make sure that India can produce a model for the rest of the world which can be emulated and which can be shown as an example. If a country of 1.35 billion people can ensure that it can do screening at a mass level, at the block level, for diagnosing diabetes early, for diagnosing hypertension early, and then of course preventing these cardiac illnesses and other illnesses, I think anyone else in the world can also do that.
Minister, thank you so much for that, for also staying here to be with us, because I know that you've got to move to another meeting as well. So we thank you for your time and also that optimistic vision for India and indeed the rest of the world. So we've been focusing on the Asia region. Let's broaden things out now, because this is where I can bring in Dr. Bandar Hajjaj. Now, he is president of the Islamic Development Bank, and for those of you who don't know about the bank, let me tell you a little bit about it. It is Saudi Arabia, and is a AAA rated multilateral development bank that works to improve people's lives by promoting social and economic development in its 57 member countries and Muslim communities worldwide. So Dr. Hajjaj, thank you so much for being here, for taking the time out to be with us. And from your perspective, how do you see the bank meeting the twin challenges of dealing with COVID-19 on the one hand and also non-communicable diseases? Because as we've learned, they are not separate. They are both two entities in one.
Thank you. Can you hear me?
Yes, we can hear you. Thank you. Oh, Dr. Hajjaj, could you unmute yourself, please? Because if you can unmute your sound, we heard you a few moments ago. That's it. Please, thank you.
Thank you. Distinguished guests, ladies and gentlemen, Good afternoon, everyone. It is a great honor to address this high-level panel discussion on such a pressing topic, and I want to speak to you today on the partnership between the Islamic Development Bank, ISDB, and the International Atomic Energy Agency, IAEA, on breast and cervical cancer control in developing countries. Saving women's lives from cancer is something that I am firmly committed to do. And I hope to see more partnerships and outstanding achievements emerging from this joint endeavor with the support of the Defeat NCD Partnership. Non-communicable diseases, NCDs, are widely seen as the first world problem. However, the reality is that they are often much more pronounced in low and middle income countries. And according to the International Agency for Research on Cancer, more than 8.6 million women suffer worldwide, and many of them die from preventable and treatable cancer. So low and middle income countries, which make up most of our member countries, are among those that suffer most. Almost half of women with breast cancer in 17 of the ISDB IAEA member countries are projected to die from this disease. This is compared to less than 22% of affected women in high-income countries. This difference is due to the vast discrepancy in availability of prevention, screening, early diagnosis, and treatment services. Distinguished guests, ladies and gentlemen, health is well established in ISDB Group vision. Since its inception, ISDB Group has approved the total financing of $7 billion for the health sector. Furthermore, since 2013, ISDB has approved $364 million in grants and loans for cancer control program in its member countries, Senegal, Uzbekistan, Niger, Guinea, Iran, Suriname, and Djibouti, to ensure uninterrupted health service for non-communicable diseases during COVID-19 crisis. ISDB Group has established in April 2021 an operational fund for saving women's lives from cancer. It aims to improve women's maternal and reproductive health in low and middle income countries by scaling up member states' health capacities for effective, safe, and sustainable delivery of cancer control services. 4 key areas are identified under this initiative. 1, upgrading, establishing cancer care infrastructure. 2, early detection, screening, and diagnosis. 3, cancer treatment. And this pillar aims to save women's lives directly and increase the capacity of existing health facilities and providers offering cancer care. 4, quality assurance. So it is a critical component as we need to ensure quality practices throughout the whole partnership to ensure we are helping women in the best way. The envisaged fund size is $500 million, with ISDB Group grant contribution $10 million, out of which ISFD has already committed $2 million. So it is open to partners worldwide. The underlying structure of the fund is based on the public-private philanthropic partnership for people, 5Ps model. It is blended of financing and grant from beneficiary countries, governments, or institutions, and third parties such as private sector, philanthropists, donor countries, and multilateral institutions. The fund will also explore how to synergize with existing fund and instrument, guarantee agreement, program, and partner. The fund will be overseen by the governing board, called Operational Fund Advisory Board, representing all donors and investors. The member countries interested to participate in the first phase of our partnership initiative are Albania, Azerbaijan, Bangladesh, Benin, Burkina Faso, Djibouti, Iraq, Cote d'Ivoire, Kyrgyzstan, Libya, Malaysia, Morocco, Niger, Sierra Leone, Senegal, Tajikistan, and Uzbekistan. This could be extended to other member countries that will come up with bankable projects. Distinguished guests, ladies and gentlemen, developing new partnership and strengthening the existing one is a priority to the ISTP over the next 5 years. On 26th of April 2020, ISTP, the United Nations Institutions for Training and Research, UNITAR, and Defeat NCD signed an agreement to enhance national capacity and scale up community-level action to screen, detect, improve care for NCD patients, support diagnosis, and provide medical device to low-resource ISTP member countries through 5Ps model to de-risk investment and fund associated projects. The 5P will enable competitive advantage, higher quality and efficiency. Significantly, they reduce the burden of the state budget to complete investment-intensive development and infrastructure project, optimizing the distribution of risk among the two sectors. Also, to address the challenges related to limited lack of access to appropriate, affordable diagnosis required to manage infections and non-communicable diseases. ISTP through STI department mobilized several global key health partners operating in the field of diagnostic and healthcare technology delivery, including General Electricity, WHO, FINPAD, to immediately respond to the shortages of essential healthcare supplies and strengthen local production capacity of medical healthcare products and significant initiative implemented with Health Associated LLC is strengthening the national laboratory system for priority medical testing within the 57 member countries. The solutions aim to develop roadmap to sustainable supply for select countries and priority diseases, considering how the 5Ps could be developed to ensure consistent, affordable, and consistent, affordable availability of testing capability. Distinguished guests, I take this opportunity to announce that we will organize a pledging event to marshal more resources toward this noble cause. Let me conclude by saying that by joining forces, we could provide a concrete platform that delivers tangible results to comprehensively address cancer prevention, screening, diagnostic, and treatment services for women in our common member countries. This will contribute to saving over 1 million women's lives from breast cancer and 3.7 million women's lives from cervical cancer over the next decade. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
And Dr. Hadjar, thank you so much for that presentation and the excellent work that you are doing and the goals which you have set. I'm sure you will reach them, and we wish you the best of luck in that. And let's move things on now, because I want to look at individual countries and what they're doing in response to COVID-19 and tackling NCDs. And this is where we can now bring in Dechen Waimo. Now, congratulations to her, because yesterday she was elected president of the 74th World Health Assembly. She's also the only female minister in the current cabinet of Bhutan, having been elected Minister of Health in 2018. So she's broken through some glass ceilings, and well done. Now, she took this job in 2018. That was her appointment, and really she has hit the ground running since she's been in this role, because she has been recognised for her highly efficient and exemplary manner in which she led the nation's health sector response to the COVID-19 pandemic. She was actually conferred with the Red Scarf, which is one of the highest honours that a Bhutanese civilian can receive in recognition of an individual's outstanding service to their country. So congratulations to Deteng Rainbow. But look, Bhutan has been addressing universal health access through the Bhutanese Happiness Index. So can you tell us how Bhutan can actually work closely with the Defeat NCD Partnership to actually address non-communicable diseases and, of course, the challenges arising from COVID-19?
Thank you, Ms. Foster, for that introduction. Your Excellency, Mr. Nikhil Seth, Executive Director of the UNITAR, Your Excellency, the Chair of the Executive Board of the WHO, my good friend, Dr. Harsh Vardhan, distinguished panelists, ladies and gentlemen. I think when we look at, before we talk about happiness, I think there are ample data and science that highlights the urgency to enable and empower government and people to address the growing threat of NCD. If left untreated, I think slowly it will consume many nations, especially many developing nations where the burden of non-communicable disease is much more higher. So we thank the UNITAR for this platform to share our humble experience. Just a quick snapshot on gross national happiness. It's a developmental philosophy that was coined by His Majesty the Fourth King in the early 1970s. The core philosophy behind this developmental approach was the belief that overall happiness and the well-being of humanity is more important than the mere economic growth. So if you look at the overall 4 pillars of the GNH, we are talking basically of good governance, green social economic development, preservation of environment, and conservation of cultures. So taking cue from this wise and well-intended developmental philosophy, the well-being and the safety of our Bhutanese people was the ultimate goal and also the bedrock on which our national COVID response was pegged. Throughout our journey, we were all guided by the wisdom of our beloved King, and I quote, "We must exhibit the strength that comes out of our smallness, remain united and support one another. During such exceptional circumstances, the government will take the responsibility of alleviating any suffering to the people due to this virus." So this basically provided the framework for the overall response of the COVID-19 in my country. In doing so, we have so far effectively managed to contain the COVID pandemic with 1 mortality so far, and of course the whole outbreak at the moment is under control. But at the same time, we realize as a small nation where universal healthcare is a reality in Bhutan, where health services are free, protected by the constitution, we realize that we must provide not only health services related to COVID-19, but also our essential health services, which are equally important. So within a very short period of time, the Ministry of Health line listed every single elderly people, every single Bhutanese with comorbidities, every pregnant mother, every child that requires immunization in 3 months. And that data, that information greatly helped us in rolling out our essential health programs with zero disruption in the country. So I think being small is indeed beautiful. Of course, then at the same time, I'm happy to see that the gentleman from ADB who also raised this concern on cervical cancer. And that was a cause that is very, of course, I'm extremely passionate about. And I remember Bhutan tabling the agenda on elimination of cervical cancer 2 years ago as a global agenda. And in 2020, Ministry of Health took upon ourselves to roll out a strategic plan to eliminate cervical cancer. And that so happened that we were the first country in the region to roll out HPV vaccination for boys above the age of 12 years. And we did that amidst the COVID pandemic. And I'm happy to inform that we have achieved almost 96% coverage of HPV vaccination, both for boys and for girls. It was a school-based program, so we hope that, that Bhutan will be ahead of many countries in the region in terms of achieving the elimination of cervical cancer target. And of course, similarly, cancer is something that having a universal healthcare package where we refer most of our cancer patients at the moment to India for treatment, we also realize that economically it's a very expensive affair. So then we focused on launching our cancer flagship, primarily focusing on 3 cancers that are most prevalent in the country: stomach cancer, breast cancer, and the cancer of the cervix. So there is an exclusive flagship program that is looking at cancer prevention, early detection, timely treatment, and palliative services for terminal cancer. So this is a holistic approach to cancer management in the country. So we have launched the flagship a few months ago, and we are very, very optimistic that when we take this holistic approach to controlling cancer, this will eventually result in lower mortality, in improving the quality of life for people living with terminal diseases, and also really raise the bar on advocacy on cancer prevention. But NCD, of course, we all know, most of us who are on this panel list know that we just can't tackle the disease. We need a very strong governance. We need a very sound policy. And we need the health infrastructure and the health resources, which many countries like myself, our country, are highly challenged. So we hope that going forward, partners will come together to invest in NCD. Because I think if left unattended, I think this is a public health threat that will consume the world. So once again, I would like to thank UNITAR for this platform, and we are extremely grateful for sharing our humble, small experiences. Thank you very much.
Thank you very much, Dr. Mango. And please, even though the country is small, it is really punching very, very hard above its weight. And I think that there are examples there that the rest of the world can follow. So thank you so much. And again, congratulations on your conferment. Now, let's move on to another of our guests to really explain what their approach is to NCDs in COVID-19. I want to bring in Dr. Mohammed bin Hamad Al Thani. Now, he's Director of the Public Health Department, Ministry of Public Health for Qatar, and also Associate Professor of Clinical Healthcare Policy and Research at Weill Cornell Medical College and Qatar University. So it's an absolute pleasure to see you. And we know that Qatar supports international cooperation via the OECD, the Organisation for Economic Cooperation and Development. What we've also learned, of course, from bitter experience, is that COVID-19 knows zero boundaries. So given those realities, how does Qatar propose to support global efforts to meet the twin challenges from COVID-19 and NCDs?
Yes, thank you, Juliet. Thank you for this. I would like to welcome all our colleagues and their excellencies for this meeting. Thank you for inviting Qatar for this. This is a very important thing for Qatar NCDs, as it's one of the main challenges in Qatar that we are tackling in the last few years, and it seems very well important, as Dr. Navarro mentioned, about this challenge is very important and related. Around 70 to 80% of deaths was related to NCDs in Qatar. Although we are focusing on NCDs in the last years, which help us to lower these deaths, but it seems that the disease has been very hurting people who have NCDs, and the infrastructure, as mentioned, Her Excellency Minister of Bhutan, has very clearly infrastructure is testing every country for COVID and NCDs at the same time. As you know, Qatar has been in the global scene, supporting 78 countries, as we believe in Qatar that we are part of the world, and solidarity is very important. And Qatar has been an active participant in the OECD Development Assistance Committee and has been supporting international COVID-19 in many countries in the region and outside the region. We are supporting the expansion of infrastructure screening of COVID-19, as well as ensuring the special hospitals has been able to provide high quality. In Qatar, we dedicate a full, biggest ICU in the region, maybe in one place to dedicate it for COVID. And we are ensuring to have a special care for identifying the global chronic diseases, especially diabetes and hypertension, that proven in Qatar that diabetes and hypertension are the highest to die, especially when they have double comorbidity. The support of this Qatar institution has non-governmental institutions have been upward to around $88 million since the onset of COVID-19 for supporting around people.
Hello, Juliet, I can't speak. When should I speak?
Do you hear me?
Yes, we can. Excellency, please continue.
Please continue.
So yes, as we can see here, that the institutions aligned with the World Health Organization, Gavi, UNICEF, UNHCR, and the United Refugee Agency. The importance of Qatar has been investing a lot in cities. It was a real challenge in Qatar in the last years, and we opened a dedicated center for that, which helped us to control the disease in Qatar and lower obesity that was very high in Qatar. And at the same time, we are having like screening for cancer and cardiovascular as a routine for people every periodically. Even the high engagement with the Defeat NCD Partnership and Qatar has been very valuable with this journey in the earliest day of this joint. Thank you, Dr. Mogul, for this support, and we are trying to support the low-resource countries as we are building many experience as a small country. We are building many experience what can work and what cannot work, and this is helping us to find a better solution after we test different sides, and we are ready to support the countries in need for this as part of our system. We have and our non-governmental organizations we will all support. We believe that NCDs is that COVID is a crisis now. It's like very important and urgent. But the real strategic countries would add always value when they focus on the important, non-urgent. People are delayed now, and we need to come back strongly to NCDs because it was forgotten in the last year in many countries. And we hope that by this important meeting, we'll support this and go together to assure that NCDs will be defeated, inshallah. So, thank you so much.
Thank you so much, Dr. Mohammed bin Hamad Al Thani. Excellent to see you. Wonderful presentation, and we share your optimism and value the work that you are doing in the fight against COVID-19 and, of course, NCDs. Let's move on now, because I'd like to introduce Dr. Daniel Ngamije. Now, he's the Minister of Health for Rwanda, and he was actually appointed into his role in February 2020. So this was an appointment which was happening at a critical time, given that we had the COVID-19 pandemic, and also something else which was taking place, because under his leadership, Rwanda has completed its national strategy and cost action plan for the prevention and control of NCDs. Now, it covers a period from 2020 to 2025, and with the support of the Defeat NCD Partnership and others involved in this relationship, the plan is estimated to reach 4.8 to 5 million people living with NCD over the next 5 years. So, Dr. Ngamije, a big job on your hands, but you know what I'd love to find out is how this new strategy responded to the pressures on the health system by COVID-19, and how you're able to continue delivering NCD services against the backdrop of the pandemic and the challenges it yields.
Thank you, Juliet. It is true that COVID pandemic has made NCD service delivery quite challenging for Rwanda and other different countries. The government of Rwanda did its best to avoid disruption of routine services, especially those related to screening, diagnosis, treatment, and palliative care for people with NCDs. The response to make sure that we keep NCD services available was articulated on different aspects that I want to share with you. The first one was that we make sure that the centralized health services are there from hospitals, but also especially we went up to community health workers, because these are our first frontline people who are in the community and they are able to be closer to the population. You remember that with COVID-19 we had 2 lockdown and with restriction of movement, so we need to manage these services, especially in this context. So the centralization of health services by including other layers like health posts and community health workers was really very critical to make sure that services are still closer to the population. The second strategy we used was to use technology, especially by using like teleconsultation. We had possibility of giving to the population some numbers of phone they can call to express their symptoms and being oriented how to be treated and where to get drugs in their community. And especially also in terms of technology, we use drones to pick blood and to make sure that blood is still delivered to remote health facilities during lockdown. And we use drones to bring medical cancer drugs to remote health facilities to avoid disruption of or stock out, to avoid stock out of this kind of drugs in those health facilities. Another strategy we used to make sure that we keep delivering services was a proactive supply chain. Normally, the way we work, health facilities are addressing their request of drugs to the nearest district pharmacy. But with restriction of movement, we did the business in another way. We went for a pushing supply approach after assessing the stock level of drugs in different health facilities using data in our systems. We have what we call logistic management information system for commodities. So we could see where there is a need of supplying commodities in a proactive way, rather than waiting that they submit their requests as it used to be before the pandemic. So it helped to avoid stock out in those health facilities. Another strategy we used was really to be more flexible with our community health insurance. Normally we have this community health insurance, and the people who are coming to health facilities, they need to do a co-payment of the invoice to avoid misuse of services. But we knew that during COVID, casual workers, they were without resources. So they could not be able to afford to make the co-payment. So purposely the government agreed for those vulnerable people who were no longer working because of interruption of services in different sectors, they could be treated without making the co-payment, at least so that anyone who has any NCD can come to their facility, showing his card as a member of community health insurance and being treated without the co-payment that it used to be recommended in normal circumstances. So that flexibility that the government decided was to avoid any financial barrier to allow even people with NCDs to get treated. Another key element that we worked to ensure that there is no disruption of services is health management, human resource management. You see, one of the consequences of COVID was that it brings new package of services in health facilities. You need to have some staff dedicated to detection, contact tracing, testing, isolation, and treatment. And you need to get them from the health facilities. So we allowed health facilities to be flexible in recruiting additional staff and additional volunteers so that they can at least assist or fill the gap in terms of additional number of staff that were required, so that you can keep services working rather than having all nurses or doctors only dedicated to COVID-19 response. So that flexibility in recruitment of additional human resource was allowed to different health facilities, and resources were given those health facilities so that we keep services operating at a certain good level rather than closing some services just because all staff are no longer available and they're only working for COVID. Another element we did was to reinforce some critical services like ICUs to make sure that we increase some number of beds so that we have some bed remaining to treat some emergencies like cardiovascular disease, diabetes, who are coming to the health facility just because they are in condition to be in need of ICU. So we increased number of beds in our ICUs so that we have beds for COVID-19, but we have also some beds remaining for some critical cases as a complication of NCDs, as I said, some cardiovascular disease or diabetes, if there is a need for being treated at the hospital. Then last and very critical, we make sure that the Ministry of Health remain with its key functions. Because COVID was there and could stay for long, the Ministry of Health was requested to keep coordinating different sectors in the response for COVID, but also for the rest of services. Mobilizing resources is also a key function of the Ministry of Health. During COVID, we managed to mobilize resources for COVID, but also for addressing other health issues, especially to fix some needs for making some outreach programs, especially for mother and children, for family planning, antenatal care, immunization, so that we are with COVID, but to make sure that we mobilize some additional resources to make sure that we can act differently and provide those services. And to end my intervention, I just want to say that COVID-19 is not the last pandemic that we need to face. And unfortunately, it's one of the pandemic which affects most vulnerable people, especially those having NCDs. So it means there is a need to set a strong, resilient health system which can resist to the request of additional need in terms of human resource, so that if there is any pandemic, we can still keep a certain level of services, including some elective intervention and normal services for NCDs and other diseases, rather than being only able to fight only a pandemic when it will occur. And last, the momentum is good today. We can see it. Political makers are now more they are willing to give more resources for health, because it appears that a strong health system is there also to sustain other sectors. So I think we should use this momentum to mobilize more additional domestic resources to invest for a resilient health system which can address NCDs and other diseases. This is a small experience that I could share with people who are watching. Thank you, Juliet.
Thank you very much for that, Excellency, and thank you as well for sharing. A really important London response has been to show flexibility, to use what it has, but to never lose sight of what the goal is, and consequently, it has yielded success in terms of containing COVID-19. Now, somebody else who was listening into that was the Honourable Dr. Amadou Lamine Samate, who's the Minister of Health of the Gambia. And Dr. Samate is also a renowned surgeon in Gambia and West Africa, a public health advocate and senior lecturer at the medical school in Gambia. So we're grateful for your presence here, Doctor. Now, drawing on the experience shared by Rwanda, what is Gambia's ambition in terms of the provision of NCD services, and how did the pandemic change that vision, if at all?
Thank you very much, Juliet, and thank you to all the panelists for this very important meeting. We really appreciate our brother's presentation on what Rwanda has been doing. We congratulate you, and I was jotting down quite all your points, so we hope to learn from what Rwanda is doing. But certainly Gambia is emphasizing our commitment to the control of NCDs. Certainly, we know the disease burden. NCD is responsible for quite a lot of mortality in most countries, and we have seen the disease trends in our countries. Before COVID, most of the deaths in the Gambia, as it is in many other countries, is due to NCDs. The Gambia is currently reviewing our national NCD policy and has commenced this in March 2021. the process of developing the new 5-year NCD strategy and costed action plan with technical support from the Defeat NCD Partnership at the United Nations Institute for Training and Research. The new strategy and costed action plan will be designed to set clear NCD interventions with expanded service packages to be provided by different levels of the health system in its aim of accelerating the country's progress to achieving the global targets. Despite the difficulties that our health system is facing to cope with the COVID-19 pandemic, we realize in the Gambia that protecting NCD patients and providing them with the best quality of care is the best way to reduce the burden of the pandemic on patients, communities, and also on our health system and economy in general. Ensuring universal health coverage for all citizens is actually our aim, and this cannot be done without ensuring that all the corners of the country are reached with regards to availability of services, testing for NCDs, and then the management of them. As of today, the Gambia has vaccinated 25,779 persons with COVID-19 vaccine, and we seek to vaccinate additional 20% of the population before the end of the year. Now, the case fatality rate for COVID-19 in the Gambia stands at almost 3%. Now, this we attribute to probably low testing in many of our facilities. Most of the testing in the Gambia is done in the urban areas. We still have encountered challenges expanding testing services to the provinces. So therefore, the total number of cases as a country probably could go up, but the mortality would remain the same, and then the case fatality rate probably would have dropped. We are poised to complete and operationalize the NCD strategy and costed action plan before the end of 2021. And we are happy to partner with the UN agencies and other partners in addressing the human and financial resource gaps required to provide sustainable NCD services to the Gambian population. The NCD challenge requires a lot of collaboration, and we welcome collaborations, experience exchange, and support within countries in our beloved continent, and all the development partners who have been and will be supporting our scaling up. COVID-19 has been a big challenge for the entire world, especially for the resource-poor countries like ourselves, with limited amount of ICU beds, with limited number of intensive care doctors and nurses in our facilities. Now, we have to scramble to make sure that we provide more ICU beds. This is the time that we had to do the oxygen connections in many of our hospitals. We have to provide new oxygen systems to be able to care for the critically ill patient. We have to rush to train capacity building, to make sure that we train our people to be able to take care of the critically ill patient. And now, of course, we also realize that the presence of NCDs was in the outcome of COVID-19. Now, this is a big challenge, but I think there are big lessons to learn from this. This is a big impetus for us to strive hard to bring the NCD burden in our communities so that diabetes and hypertensive disorders and all other cardiovascular disorders are brought down to the barest minimum. Therefore, it is very, very essential, and learning from the experience of Rwanda and other countries, to have an early diagnosis of NCDs in our communities. The control system, the control mechanisms have to be strengthened. The advocacy is very, very important, so that people healthy lifestyles, so that we have a community that is healthy, just in case any pandemic comes on again. Because considering the high level of travel in modern days, people moving within 24 hours to all corners of the world, any infectious disease has the tendency to reach the entire world within a very short period. And with people being predisposed to these infections and to development of severe forms of the disease, therefore we need to tackle the NCDs, especially diabetes and cardiovascular diseases, very, very seriously. One challenge I want to share with the panelists is that we had an interesting challenge in the sense that at the peak of the pandemic, when we have a lot of cases and a number of mortalities, people were scared to go to the hospitals for their medications. So we are happy to pick up from the Rwandan experience so that medications will rather meet the people in their homes. So I think that is a big lesson, because people really thought two things: that the hospitals themselves were a possible source of COVID-19 infection for them. So they would rather not go to the hospitals. The second one was that actually that the COVID-19 diagnosis probably would be made to them, on them rather, when they get to the hospital. So the stigma associated with COVID-19 also kept them from going to the hospital, with the fear that by getting to the hospital they might get diagnosed with COVID-19. I'll take a break for now, but I thank all the panelists for all your insight and all your wonderful contributions. Thank you very much.
Thank you very much, Dr. Ahmadou Lamin Samate. Please forgive me for the slight error there on the pronunciation of your name, but thank you for really taking us through the Gambian experience and seeing that cross-fertilization between what is happening with your country and also with Rwanda. So thank you. And also as well, I want to refer back to the very beginning of the first presentation that we actually had, in fact, where you had the statistics beautifully explained and really the bedrock to them. That study carried out with, amongst others, the Economist Intelligence Unit. But again, another important player in this was Beatrice. Now I want to introduce Manasi Tadasi, because he's the president of emerging markets at Beatrice. And we know that the Economist Intelligence Unit, the Defeat NCD Partnership, and Beatrice, they collaborated together to collate global data to examine that connection between COVID-19 and NCD mortality. So, Manasi, given that, can you throw some light on that COVID-19 research, the results, and what it means for a company like yours?
Thank you very much for the question, Juliet. Before addressing your question, though, I want to go back to the opening and really build upon Dr. Navarro's opening and some of the comments that I've seen in the chat box. For me, there are two critical takeaways. It is absolutely undeniable that NCDs and COVID-related mortalities are linked. So I hope everybody's gotten that sense, and excellent panelists that have spoken to that. The second point that is important for us to take note: NCD is a marker of socioeconomic development. So for me, as head of emerging markets at Beatrice, if you hear nothing else from me, as countries, as partners, as stakeholders, everybody's speaking to this, our ability to be able to invest in healthcare infrastructure as a priority, like other areas like education, infrastructure, and the like, is absolutely important. If not, we're exposed, and we've seen that, and we'll be exposed as we go forth again. A special sort of emphasis to the low middle income countries, which I'm responsible for. But Juliet, now getting back to your question, I'm glad to share my thoughts about the data that's been presented by the Defeat NCD Alliance, which is a joint study with the Economist Intelligence Unit, which we obviously sponsor. So in spite of the global trend of diverting resources from NCD care to COVID-19 mitigation, what has clearly been determined is that NCD mortality is the main driver of COVID-19 fatalities. In August of last year, a study was published in Lancet Journal, which estimated that approximately a fifth of the global population has at least one of these underlying conditions, which puts them at increased risk of severe consequences if the person is infected with the coronavirus. In fact, what we've seen now with NCDs is if you have diabetes, cardiovascular disease, chronic respiratory disease, cancer, and other NCDs, you're estimated to contribute 60 to 90%. I'll say that one more time, because this is an enormous number. 60 to 90% of COVID-19 deaths. The bad news doesn't end for survivors as well. Various studies have found that COVID-19 has exacerbated the progression of pre-existing NCDs and has caused even new NCDs, more complex ones, in previously healthy COVID patients around the world. So as we look into policy decisions that have influenced the turnout of this pandemic, we really have to focus on robust health systems, tackling NCDs to be able to make sure that we have greater capacity in reducing the impact of COVID-19 or other pandemics and reducing the fatality rates considerably. As a whole, this was also mentioned a little earlier, the global community has committed over $10 trillion to the COVID response. Ironically, the world would have reached its UN Sustainable Development Goal of reducing NCD mortality by a third by 2030 just with this money. So look, the link between NCD mortality and COVID-19 is absolutely undeniable. I hope that's crystal clear at this point. Every step that we take to invest, to be able to push policy towards NCD care, is really a push towards COVID care and population health as a whole. The statistics are well known by myself and my colleagues at Beatrice, but for the folks on this conference as well. 85% of all NCD deaths take place in emerging markets, which is a region I oversee, 125 countries plus. So from a Beatrice perspective, our scientists, medical professionals, regulatory experts are hard at work trying to reach vulnerable communities and to be able to access vital health care. And this is work that has paid off. Beatrice is among the leading healthcare organizations the citizens look to be able to find therapeutic solutions to treat NCDs and, for that matter, other ailments. On a side note, Juliet, since it was mentioned, the HIV concern that was raised a bit earlier, as the world galvanized to be able to address this enormous challenge, I'm happy to tell you that Beatrice played an important role in being able to respond to that challenge and continues to play an important role as we go forth. Our approach has been to deliver healthcare through three particular pillars: access, leadership, and partnership. And we hope that the findings of this research will spur healthcare professionals, partners, NGOs, governments, to really be able to join us in undertaking to provide sustained and widespread access to effective treatments and prevention of NCDs. Shortage of medicine, diagnostics, technologies are amongst the leading causes for the delay, reduction, or cancellation of NCD treatments during the pandemic, and this was well spoken to. So we must work together to be able to get after sought-after products and treatments to quickly and efficiently provide access to those in need. The research has obviously highlighted the importance of looking beyond immediate requirements to address potential future NCD issues in a holistic approach, and to be able to motivate industry to chart innovative paths like those that have been crafted through the Emerging Markets NCD think tank, which is dedicated to improving local NCD outcomes and co-designing approaches to really find solutions. And in many cases, we talk about beyond the pill solutions. So lastly, we hope that these findings by the Defeat NCD Partnership and the EIU will soon be published, and events like this will help foster more meaningful partnerships to be able to reach developing countries which are struggling with vulnerable healthcare needs. So this is why Beatrice has signed this memorandum of understanding with UNITAR for the Defeat NCD Partnership, an agreement that ensures our commitment to achieving the UN Sustainable Development Goal of reducing mortality by a third by 2030, enabling all low-resource countries to be able to scale up action against NCDs. This partnership enables us to be able to collaborate more closely on initiatives that will help people live healthier lives so their societies and nations can prosper in all ways. This pandemic has shown the heights which we can achieve when we work together to be able to address urgent threats to global health. With this research finding, we aim, and I personally aim, to be able to achieve similar heights against the fight of NCDs. This is one that requires innovation, but specifically also action across the board, from healthcare leaders to policymakers to all of us as stakeholders in this important fight. So thank you very much, Juliet, and for all the distinguished speakers, extremely helpful and very knowledgeable.
And Manasi, we thank you very much for explaining that research and obviously the objectives coming out of that. We wish you the best of luck in fulfilling those. Now, there are a couple of other presentations left, so please do bear with us. I know that we have slightly overrun time, but don't worry, because so much has been discussed and there is so much that you, our audience, have responded to, and we really appreciate that. Let's stay with that research that Manasi Didasi was discussing a few moments ago, because I want to bring in Chrissy Bishop. Now, she is an associate in the Health Policy and Clinical Evidence team at the Economist Intelligence Unit. Chrissy, thank you so much for being with us. And can you briefly tell us about the methodology which was employed in this research, because the results themselves were quite astounding.
Yes, sure. Thank you very much, Juliet, and thanks everyone for the really inspiring presentations so far. It's such an honour to be able to listen in. And yes, this research, I know when you think about the relationship between NCD mortality and COVID-19 fatality, There's so many factors that influence that relationship, and I've been watching the chat as people have been putting in some of those factors, such as socioeconomic status and excess deaths. So what we wanted to do was make sure we chose a modelling approach that was robust enough to account for all those factors in order to get a reliable estimate of COVID-19 fatality. And we used several different methods. One was a visual mapping exercise where we looked at every single possible confounder, which largely linked or grouped around demographic factors, COVID-19 response, including testing, population density, and even some climatic factors such as air pollution. And then we explored several other adjustment factors using a machine learning algorithm. So surprisingly, no matter which adjustment factor we used, the results were fairly stable once we'd accounted for these confounders. Interestingly, when we didn't adjust for these confounders and we simply plotted NCD mortality against COVID-19 fatality, we saw an inverse correlation, which is confusing. But after the adjustment, the opposite was the case, as Praveen mentioned earlier, where you have a 10% decrease in NCD mortality could have resulted in a 20% decrease in COVID-19 fatality. So in a nutshell, that is it, Juliet.
Chrissy, thank you very much. It was very, very comprehensive, and it really contextualises everything that we have heard and the importance of focusing on NCDs, not just in fighting this pandemic, but tragically, future pandemics. They may not happen in our lifetime, but they will be there in somebody's lifetime. Let's move on now, because I want to bring in Dr. Bente Mikkelsen. Dr. Mikkelsen is Director, Non-Communicable Diseases in the Division of UHC, Communicable and Non-Communicable Diseases at the World Health Organization. And as we've been hearing, the pandemic has had an extraordinary impact across the world. It's affected the global supply chain and also NCD supplies themselves. But it's also had a trickle-down effect on healthcare systems in terms of their ability to provide NCD services to the population. We've also heard panelists as well referencing the Defeat NCD marketplace. So how do you think the WHO can support the efforts of that marketplace to ensure that quality-assured, affordable supplies can be made available at all times, regardless of where they are in the world?
Thank you, Juliet, and Excellencies, Defeat NCD Partnership and friends, or I would say uninterrupted health services for NCD during COVID. It has been a thrill to listen to all the different partners, including the government speaking today. And I just want to start with, I'm now very happy that the unfortunate deadly interplay between COVID and NCD is understood, documented, and the question is, are we acting to the extent that we need? The second is that I understand that most of us understand that UHC is really the way to be better prepared for the next pandemic. And the last thing is, which is a reiteration of a Lancet publication from last year, that there will be no UHC without NCD. And I think this is an important sort of entry point. And as we have seen during the COVID pandemic, the interruption with the health system is really alarming. And we have seen that there is a big shortfall that adds to the shortfall of coverage that we have seen before the pandemic. So the way WHO support is, of course, through being let's say, the platform. We have a huge impact at country level. On the 3 levels of WHO together, we help governments to, across the different ministry and development partners, to promote whole of government and whole of society. And this is important because the access to medicine and health products is, of course, a very important piece, but it has to be seen in a context. And of course, the development of the UHC compendium products has been very important in supporting now governments really more and more interested in getting NCD into UHC and then also access to medicines as part of it. Actually, you may know or you may not know that the main request for support from WHO in this biennium is exactly this, to bring NCD into UHC and to strengthen primary health care systems. Many of you have mentioned the detrimental cost of medicines, and this was before the pandemic. We know that the out-of-pocket payment is really driving many families into poverty. And our first pulse survey that we did in May showed that one of the main disruptions of the health system was actually access to essential medicines. So what we do in the WHO is a lot of things, but since you asked me a very precise question, I'll drill down to that. So in the WHO NCD department, we are supporting countries, of course, to scale up their investment in general, to build capacity in health workforces, to look into the capabilities of addressing both communicable, non-communicable, and then it's about the essential health services. One of the major interventions that we are now advocating for is to get away from the silos, because it's been a silo for malaria medicine, for HIV/AIDS medicines, and other kind of medicines. We need to really look across programs and look into horizontal integrated systems. And I would like to say that we need now to fly on the wings in the center of the COVID. So we have developed a COVID Plus approach, which we hope will get some traction. And that is actually to use some of the innovations we have seen during COVID in Act A, in the health system connector, to really utilize the cold chain to, for example, deploy insulin and disseminate insulin through the same chain. We have had already one very important private sector dialogue on insulin. We will continue with this on diabetes later this year. And of course, we will cover all the essential major NCDs. We are also in the middle of a global diabetes compact. Many of you mentioned that one of the real at-threat populations are the people living with NCDs, and especially diabetes and cardiovascular. So access to these medicines are very, very important. And then we are doing assessments during MedMon. A marketplace will fit very well into this picture, because we need to address both the pre-qualification and the international procurement mechanisms. And at the same time, we also need to increase the competition of quality assured products in parallel to develop mechanisms to create a market for producers and pre-qualified products. So pooling demands, creating reliable payments and financial management is very, very important. So we look with a lot of interest and curiosity to what the Defeat NCD now is establishing. And I think it fits very well into the architecture that we need to now focus on. And just to add the last sentence, I mean, the last year is the first time we are really able to leverage on access to medicines and health products for NCD big time. So let's now use the innovation, the cooperation that we have seen during COVID, and also use this opportunity to include NCD to UHC, to get UHC coverage before 2030 or actually earlier, and use these kind of approaches to really build the preparedness needed for the next pandemic. Thank you very much.
Thank you very much, Dr. Bente Nicholson. And before I actually hand things over to Mukul Bola, who's the Chief Executive of the Defeat NCD Partnership, I want to put a very quick question to Dr. Ben Shao, who's the Practice Manager, Strategy, Operations and Global Engagement at the World Bank. So, Dr. Shao, thank you so much for joining us. And the question I want to put to you is, the World Bank has supported the global response to COVID-19 and NCDs through health sector financing. So what are the current challenges that you see in meeting that UN Sustainable Development Goal 3?
Thank you, Juliet. Very happy to be here to discuss this very important topic with such a distinguished group. Just very quickly to your question, the global health community is facing an unprecedented crisis. COVID-19 pandemic has affected people's lives and also people's livelihood. But at the same time, we see NCD is another, quote, quiet pandemic, unquote, which produced the highest global disease burden and become one of the top priorities and health challenges in many countries, as many distinguished health minister has mentioned. But it's also have a global reach, not only affect mid-income countries, high-income countries, but low-income countries also facing the similar challenge. It's also intertwined with aging, lifestyle, behavioral change, and risk factors. So it's really become another global issue. At the World Bank, we see respond to COVID and addressing NCD really have a common goal and common targets. I really like today's topic about this twin response, which really integrate COVID response and our effort to address NCD. The way we see it, there's a few priority areas we really need to pay attention collectively. One is to use innovative financing and incentives. We have seen evidence from tobacco taxation, from different innovative financial tools which really can help change people's behavior because NCD is something really go beyond health sector. So that's one thing we probably need to do more. The second area is to integrate NCD services into the health service system, particularly into PHC, primary health care. This is an area we can do more. And the third one, as many ministers has mentioned, the early screening program is really critical on cancer, on cardiovascular diseases, on other NCD problems. This is area the bank, in addition to our COVID-19 response program, we're willing to put in a lot of support and financing into it. And also we have existing project in different countries has generated very strong evidence in terms of results. Last point is the bank now is taking on a so-called GREEN agenda, which is green, inclusive, resilient development. The resilient part, which health sector has a big role to play. To have a resilient health system is not only mean we can address COVID or future pandemic better, but also we should maintain the essential service system, which during crisis we can continue to provide essential services to our population, to our citizens. So that's the common agenda I say we can jointly take on. Let me stop here. Thank you so much.
And thank you so much, Dr. Feng Xiao, for answering that question. And I would now like to hand the floor to Rakul Bola, who's the Chief Executive Officer of the Defeat NCD Partnership, to share his final thoughts. Rakul.
Thank you, Juliet. On behalf of the Defeat NCD Partnership, I'm really overwhelmed at the broad-ranging multinational, multilateral, private, and corporate expressions of support for the call to action, ensuring uninterrupted health services for NCD patients during the COVID-19 crisis. It's clear that by joining forces through our partnership, we can assist the world to reduce premature mortalities due to NCDs by 1/3 within the time frame of the SHG's 2030, while at the same time mitigating the impact of COVID-19. I'd like to start by thanking Dr. Harsh Vardhan, Minister of Health and Family Welfare of India, for sharing the valuable lessons learned from India's ongoing challenging battle against COVID-19 and non-communicable diseases. I'm pleased that India will be collaborating closely with the partnership to focus on a comprehensive approach to NCD control both in India and beyond, with our focus on 90 low-resource countries. Dr. Nabarro's opening statement really set the scene. As Special Envoy of the WHO DG on COVID-19, he spoke very powerfully about how COVID-19 has revealed and exploited existing vulnerabilities in societies, which set the context for today's session on how there may be synergies between the twin challenges of COVID-19 and NCDs, and how we find solutions to these challenges. The President of the Islamic Development Bank, I'm really glad that we concluded an agreement with the ISDB last month, and he's outlined very clearly some of the joint work we'll be doing on innovative financing across the 57 member states of the Islamic Development Bank in an effort to explore and finance universal access to healthcare. The Health Minister of Bhutan, who was yesterday elected the President of the 74th World Health Assembly, has set an outstanding example of how we should look holistically at the commitment to health as part of national vision of happiness, which can keep both COVID-19 and NCDs at bay. So we look forward to kicking off the Defeat NCD's program support in Bhutan later on this year. I'm really very pleased that our team in Rwanda, working closely with the NCD department and the Minister of Health personally in Rwanda and his team, have developed the $376.2 million National Strategy and Costed Action Plan for Rwanda for 2020 to 2025. This, all in a time of the COVID pandemic, has really been quite commendable. This plan, when implemented, will directly benefit some 4.8 million people. And we also heard how innovative technologies and flexible approaches to financing and recruitment are ensuring uninterrupted service for NCD patients in the country. We're now embarking on the same path with our team in Gambia, which is based in the Ministry of Health since April this year, working closely with Dr. Samate, the Minister and his team, on developing a new 5-year strategy and costed action plan for Gambia. We hope that these efforts will contribute towards Gambia's overall efforts to achieve SDG 3.4 by 2030. We're also very pleased that Dr. Al-Thani was able to join our session today. Qatar has been a consistent supporter of the partnership since its earliest days, and I recall visiting Qatar just before the pandemic and speaking to Dr. Al-Thani and other government officials about our plans at the time. There were still plans of supporting Rwanda and Myanmar at the time, and I'm really happy that today Rwanda has signed off on its costed action plan and strategy. And not only the document, but we're actually also supporting the country in mobilizing resources towards this plan, so it just doesn't remain a document, if you like. So we look forward to strengthening our work with Qatar to further promote UHC, and Nikhil and myself shall be visiting shortly, hopefully next month, inshallah. I'd really like to thank Manasi, President, Emerging Markets at Beatrice, and Chrissy Bishop and the team at the Economist Intelligence Unit for working so closely with Praveen and our team to shed light on the unique causal relationship between COVID-19 and non-communicable diseases. As Praveen mentioned, the partnership is framing the challenge of tackling NCDs as a means of mitigating the impact of COVID-19, and we welcome Beatrice today joining the Defeat NCD Partnership to the signing of an MOU earlier this morning. UN Assistant Secretary General and Executive Director of UNITAR, Nikhil Seth, clearly explained the relevance of the core competencies of the partnership for enabling low-resource countries to achieve SDG 3.4. These are national capacity building, community upscaling, and sustainable financing, and ensuring universal access to quality-assured, fairly priced drugs and diagnostics. And in that vein, in addition to supporting the governments, we're very much supportive of the work that Bente and the team at WHO has been leading on over the past few months. The surveys, the amazing results in terms of the Global Compact Initiative for diabetes, and the marketplace really is all geared up now, starting September, to start fulfilling some of those urgent demands that we're getting from governments. So we look forward to collaborating with WHO on the pre-qualification, on some of the pricing issues, the market shaping work, and really providing value for quality, affordable drugs and diagnostics to these countries, to the marketplace. In closing, Dr. Tedros, the DG of WHO's opening remarks at the WHO yesterday, he said this is not the time for incremental improvements or tinkering at the edges. This is the moment for bold ideas, bold commitment, and bold leadership for doing things that have never been done before, a sentiment that we at the Defeat NCD Partnership share within the session today. So on behalf of UNITAR and the partnership, I assure the global community that we're ready to support this call to action in all our program countries and initiatives. Thank you so much. Over to you, Juliet.
I didn't realise I was going to have the closing words. I thought that was your privilege, McCall.
You do.
From my perspective, thank you. From my perspective, it really has been an extraordinarily few hours that we've been together, and really the case for recognising that NCDs are the doorway through which COVID-19 roams and causes devastation. But we have learned from the experiences of many experts and indeed health ministers of different countries that if you tackle the NCDs, you can strike out, push back against COVID-19. It means everybody working together, not just in governments, but as we saw from the Asian Development Bank and the Islamic Development Bank, banks getting involved, and also from companies like Beatrice, also getting involved with research and helping to guide the narrative forward. Thank you for everything that you have done, all of you, the work that you continue to do. Thank you for being here, and I look forward to hopefully seeing you again sometime in the not too distant future. But thank you for your excellent contributions. Take care.
Thank you. Thank you so much. Thank you.
Bye-bye.
Thank you.
Thank you, Excellencies.
Thank you.